what you're saying is that there can be whole gradation from like highly intensive, just 4 days, to like 1 month, to people getting like 2-3 times a week to once a week. So we should be very flexible in our thinking. We should not be rigid, and we should think of these different options depending on the patient's needs, the patient's willingness.
And patient's ability to learn. I mean, we all learn at different rates, at different paces. Some people get quickly and some people slow. Some people's the stress is extremely difficult. We have very smart OCD people who know all the principles but cannot do it. So they need a lot of support. They need a lot of small steps. So they might take a little bit longer.
So in this context, let me ask about flooding. Because flooding has, some patients come in and they think they are afraid of going for ERP because they think that they are going to do flooding and it's going to be terrifying. I know that one of the people in your group it told us in the class when I was a resident that he took the patient to the 30th Street station and who had a fear of contamination, and he had the patient rub his hands on the bathroom floor of this public bathroom and put it on his face. And I was like, oh my God.
Right. So I love this question because when I teach this to other people too, I want people to understand the principle. Again, it's a matter of principle. Just like in any other intervention, and definitely in medicine, we do this a lot, right? Is that you need the dose that is the right dose for this particular person's needs. So if somebody learns the principles, that they can now not worry about anything and they can touch anything, they're not worried about the contamination anymore from a smaller contaminant, then that's fine. When somebody has to do the 30th Street station, it means that all the other steps still didn't teach them that it's going to be okay, even though you could be immersed in filth. So we don't want an extreme in every case. Okay. Now, let me just answer something about the flooding. The original studies did a comparison between gradual exposure versus flooding. They both worked, but the responses from the clients, the people who did the studies, is gradual is better, it's easier, it's more tolerable. So in order to have compliance, we probably should do what most people can handle, which is small steps at the beginning, learning the principles, and then we can see how far they need to go to function well.